Hi everyone, welcome to week 6 of your pharmacy software course. This week we are covering chapter 6. Chapter 6 is all about inputting compounds. So before we can do anything as far as that goes, let's talk a little bit about what a compound is. There are a lot of drugs that we can get from the wholesaler. A lot of things are manufactured and we can get them and we can dispense them straight to the patient. However, there are drugs that have to be that are either not available in a particular strength, that have to be combined with something else to make what the doctor ordered, things like that. And so anytime we have something that's not available commercially, we can't get it from the wholesaler, we can do something called compounding. And there's basically two types of compounding. There's sterile and non-sterile compounding. Non-sterile compounding means that we do not have to use any kind of specific techniques as far as making sure things are sterile. So sterile compounding means we have to have a clean room. We have to have a clean room. We have to follow specific guidelines for the clean room in order to prepare the compound. Typically, these are IV types of drugs, anything that's going to be administered intravenously. And most of those are obviously going to be prepared in a hospital setting, although we do have some of those prepared in long-term care and home health settings. However, the non-sterile compounding is probably the most common in the retail setting. So that's what we're going to focus on this week in this particular chapter, is how to input a compound for a retail setting. That's the examples that they're going to be using. So the first thing that they're wanting to do is they're wanting us to access the compounding screen from this main screen. So you have to go to the main screen 1 and then you're going to access the compounding. So in order to do that, you're going to hit the DG screen. Okay, and you'll see that the one that they have given you as an example is already there for you. And so this is where we're going to start. And now once you get here, we can look up and see what formulas do we already have in here, what compounds are already been prepared. And basically what this is we're looking at a list of recipes. We're looking to see what's already put together, what we've already got recipes for. And then if we don't have a recipe, we're going to start entering one. So that's what this week is all about, is how to enter that particular recipe. And I just want to point out that it's so much like a recipe when you're cooking. So you're going to want to make sure that you are following that recipe exactly, because just like when we're cooking, it won't turn out if we don't have the recipe correct, right? So I want you to go ahead and turn to page 68 and let's take a look at this week's assignment together. I want to point out a few things about this and then also discuss how I want you to turn this assignment in. Because this week, you're really just turning in one particular screenshot and answering a couple of questions, and that's it. So what you're going to be doing is going to be, searching to see if everything's there and following those directions, adding a drug if it's not, those types of things. But then you're going to create this compound, this magic mouthwash compound. And they have the recipe there in the little gray box on page 68. Now, this particular recipe says we're going to use 1 part viscous lidocaine 2%, 1 part Maalox, 1 part diphenhydramine, 12.5 milligrams per 5 ml elixir. So those are the 3 drugs that we're going to be using. So those are the 3 drugs you want to make sure are listed in the database already so that we can use them in the recipe. And they give you the NDCs for all 3 of those, so you can look them up that way, whatever, up to you. Now, the next thing I want to point out is the quantity. It says we're going to make 120 milliliters. Now remember, that recipe said we're going to use 1 part lidocaine, 1 part Maalox, 1 part diphenhydramine. What that means is everything is going to be mixed together equally. So if I need to make 120 milliliters, that means that I'm going to need 40 milliliters of each. And why 40? Because I have 3 ingredients and I have to use the exact same amount of each. So 120 divided by 3 gives me 40. That's where the amount comes from for each of these 3 ingredients. Okay, so as you put these in and as you write the prescription and the recipe for this particular drug compound, what you're going to be doing is taking a final screenshot once you have completed everything. So once you've listed the supplies and you've put it all together, including the quantity of the ingredients, which is discussed in exercise 2, and the cost of each ingredient, which is discussed in exercise 3, then you're going to take a screenshot. So you're going to want to input all of that information for exercises 1, 2, and 3 into the recipe. Then you're going to take the screenshot, put it into a Word document, and submit to me for your assignment this week. Then after you do that, after you have your screenshot, at the bottom underneath that, I want you to answer the questions for exercise 3. So you're going to answer those questions so you can tell me, where did you get that information? How did you decide what to put in there for the cost? So if you have any problems or questions, as usual, please make sure that you reach out to me, and have a great week.